At the end of a cardiac cycle, the ventricles are as empty as they will get, and since they are at the end of their systole, this low volume is referred to as the end systolic volume. When the AV valves open, the ventricles begin to fill as blood rushes from the atria into the ventricles. This occurs rapidly at first, and then a bit more slowly. The first portion of this filling is known as passive filling, since no muscle contraction is powering it. Simply blood is flowing from the full atria into the ventricles. When the atria depolarize in the P wave, shortly afterwards they begin their systole. And the atrial systole during the remainder of the PQ interval will eject the remaining blood from the atria into the ventricles. At the end of this period, the ventricles are now as full as they will become. This is known as their end diastolic volume. When the semilunar valves open at the end of the QRS complex, the ventricles can now eject their blood. And the volume of the ventricles will decrease from the high point at the end of their diastole, the end diastolic volume, and as blood leaves the ventricles, the volume decreases to the end systolic volume, the lowest volume of the ventricles, the ESV, as opposed to the EDV. This stroke volume, the amount of blood which leaves the ventricles, is about 70 milliliters, and this occurs from when the semilunar valves open at the end of the QRS complex to when the semilunar valves close during the T wave.